Good afternoon, everyone. I am Commissioner Kevin Morrison, and I represent the 15th District of Cook County, which covers most of the northwest suburbs. Thank you for joining me, whether live or watching this recording. Today, I'm glad to have incredible guests with me who are working hard every day to prevent the spread of COVID-19 and provide other critical services to individuals throughout suburban Cook County. We have now been fighting COVID-19 for close to 1 full year. The Cook County Department of Public Health has been on the front lines from the first case that was treated right here in the northwest suburbs. We've come a long way, and with the vaccine, we are even closer to beating this awful virus. And after receiving a contact tracing grant, my guests today are working with Ccdph, including with Dr. Joshi, who you'll meet soon, to help their outreach efforts in some of our most hard-to-reach communities. These funds will go a long way to supporting the work being done by these great organizations. Next, my guests will tell us more about how their organizations are supporting Ccdph's mitigation efforts. Then I will let Dr. Joshi give us an update around the COVID-19 vaccine distribution and contact tracing efforts. Then we want to hear from you. Please put your questions in the comments, and we'll do our best to get to each one during the discussion portion of today's conversation. Again, I hope all of you joining us today are keeping safe and healthy. But without further ado, I'd like to introduce the first grantee organization with us. We have Arab American Family Services. And thank you so much, Narman and Itadel, for joining us today.
Thank you so much, Commissioner. Thank you for this great opportunity. Hi, everyone, those watching us. My name is Nariman Taha, and I am the co-founder director of Arab American Family Services. My apologies, Commissioner Itadel couldn't be with us today, but thank you for this great opportunity. We are really excited to be part of one of the grantees funded by the Cook County Department of Public Health and the Hecton Institute to mitigate COVID in our local communities. Just a little bit on Arab American Family Services. For those who don't know us and watching in, Arab American Family Services is located in the southwest suburbs. We are not in the commissioners. Commissioner Morrison is a wonderful person and a great person to work with, but we are not in his district. We are actually in Commissioner Donna Miller, which I believe is district number 6 in the southwest suburbs and the city of Worth. In our part of town, southwest suburbs, we have a large Arab American community, which, by the way, Commissioner, you have a large Arab American community as well in your district. So the fact that we're here today is really something that we are grateful for, because we want to reach all communities. Our office has been around since 2001. This year actually makes 20 years. We are a social service organization, a one-stop social service organization with a multitude of services. Our programs are comprised of case management, public benefits, helping low-income families and individuals apply for medical card, food stamps, unemployment, women and children, WIC, interpretation, translation. We have elderly services. We have programs catered to 60 and older. Again, making sure that they learn how to and identify resources and navigate the system. We also have domestic violence, mental health, immigration, English second language. These are programs that are in place to make sure that we can help our local families navigate the system and identify resources, especially to immigrant communities and marginalized communities, individuals who don't know how to navigate the system, individuals who don't speak the language. I mean, it's hard as it is for English-speaking individuals. Imagine how hard it is for those who don't speak the language or don't know how to navigate the system. And that's what Arab American Family Services is about, is to really to alleviate that stress, that whether it's mental, emotional, financial. So the commissioner mentioned COVID it'll be almost a year with us. And in that time frame, what Arab American Family Services is still in operation like any other organization. We do operate remotely. We do have some projects that we have, like many of us, as you'll hear from other speakers, which we provide either through drive-through. So a lot of our, for example, we have annual projects and ongoing projects to help our families during these times of need. We have For older adults, we have our congregate meal that takes place 3 times a week, where older adults come and pick up their food, drive-through. We also have food boxes that we have families, at one point for a good number of months, we had families, almost 1,000 families pick up boxes from us on a monthly basis. We do telehealth. During COVID, unfortunately, you couldn't come and do in-person counseling, but we provide telehealth by phone or computer, virtual. But that is ultimately what we're here to do. And getting this grant and receiving this grant adds to what our existence is, what our mission and vision is about, is really to help families in these challenging times to have resources and, again, accessibility. One of the things that we found in our community, when we go back a little bit, is, and Justin, please jump in and tell me where my time is. The Arab American community, when we talk about numbers and how COVID has impacted communities across the board, we tend to hear about the numbers of statistics on the Black community, Latino community. With our community, the Arab American community, is a little bit hard. The Arab American community is labeled as white, so we don't have statistics on the numbers of how COVID has impacted, the number of COVID impacts into the community. It's unfortunate that I don't have a number, but we know that it has impacted it significantly. Like all communities, our family members and friends, community members have been impacted with COVID. You'll hear the same issues, challenges, the severity of COVID on that individual. But the reality, what we are able to bring to the community with this grant is now accessibility to getting tested. There are 3 components. Let me just step back a little bit more. With this grant, we're able to educate the community on COVID, the do's and don'ts of COVID, the impact of COVID on the community. But also with that, we have partnered with a local community clinic, Premier Urgent Care, which we bring accessibility of testing to community members. A lot of our community members didn't know where to go for testing. A lot of members didn't know, what sites were available, what sites are taking individuals in. And one of the biggest hurdles for individuals and across all communities is not having insurance. People were afraid to go out and get tested because of, again, the inability to pay. The not having the financial means. They were worried that they might have to pay. They don't have insurance. They're low income. So this is one of the reasons that we are so proud to have this grant, because it really targets those communities. It targets low income individuals, people who don't have insurance, and undocumented individuals. So if you're hearing me speak about today, if you're not just an Arab American, but if you're looking, and if you live in the southwest suburbs and you're looking for a place where you can go and come get tested, please reach out to Arab American Family Services at 708-599-2237. And we have actually, it's located in Burbank, and call us. We will set up an appointment for you with the clinic, and we can get you tested at no charge. And that is what we're really, again, grateful for that partnership. But I also want to add one more partnership that we just recently joined under this grant. We also have a TCA Health, which is a federally qualified health center, which we also will be working with them to provide another site of testing for community members. And we're just working out the details with that partnership. But this is what we're bringing to the south and southwest suburbs, is accessibility of COVID testing, which is really, really important. That is what we heard in the community. They didn't know where to go testing. They didn't have the means for the testing. People were afraid that they would be charged for testing. And that's what we're really, again, we're going out to educate community members that whether now we have a site for you that understands the language, that can speak to you in your respective language, can educate you, and you don't have to worry about the means. We want to mitigate COVID. We want to make it accessible. And that's what this opportunity is about. And that we're grateful for this Cook County Department of Public Health relationship and partnership.
Nariman, thank you so very much. I greatly appreciate all you're doing for our communities. Thank you so much. Next up, we've got Todd Stahl, who is with Journeys the Road Home. Todd, thank you so very much for being with us today.
Thanks for having me. Can you all hear me?
Yes, we can hear you.
All right, great. Well, thank you, Commissioner Morrison, for inviting Journeys to this town hall. It's our pleasure to be a recipient of the HECTON grant through Cook County Department of Public Health and to serve our community. The agency I represent, Journeys the Road Home, specializes in housing services in the northwest suburbs. We are the one-stop shop for people without homes or at risk of losing them. Unfortunately, due to the pandemic, we have seen a massive increase in need. We have 3 main programs. The first is a day support center that operates Monday through Friday, 8:30 a.m. to 4 p.m. The second is a hotel shelter program that operates 7 days a week. And the third is a housing readiness program that partners with many agencies throughout the Cook County suburbs to get people into stable housing. Prior to COVID, folks may have been familiar with our pad shelters that are hosted in faith communities. Unfortunately, when the pandemic hit, we had to close the pad shelters down and transition clients into hotels. This was a very big logistical challenge. As this happened, the support we saw from community members and Cook County officials like Commissioner Morrison was both unprecedented and amazing. And the support led to some specific successes I'd like to highlight. First, we received federal and county grants to shield vulnerable people from COVID by housing them in hotels. So the population we serve trends older and with many pre-existing conditions. So we had to take some aggressive action alongside our community to protect the clients. And we've kept an average of 110 guests healthy each week in hotels. In addition, we have only had 3 clients test positive for COVID since the pandemic began. All 3 had mild symptoms and made a full recovery, fortunately. When each person tested positive, we worked with our healthcare partners to engage in aggressive contact tracing and help stop the spread of the virus. And I really, truly believe our success shows that the hotel shielding model works very well. The second success I like to mention is the healthcare partnerships that Journeys has deepened over the last year. The pandemic has highlighted just how important working together across agencies is when you're managing a public health crisis. Our main healthcare partner has been Heartland Alliance. We've been very fortunate to work with a lot of their amazing staff, especially Mary Tornabene. They've provided primary healthcare for clients, ongoing surveillance testing for clients and staff, and education for everyone on infection control. We have also been supported by the Advocate System of hospitals and various county departments, including the Cook County Department of Public Health. And I just want to shout out, we appreciate all of their support, especially in getting us necessary personal protective equipment, because we're still working face-to-face with all of our clients. In addition to these healthcare partnerships, we have strengthened relationships with agencies that do the same type of work that we do, like Northwest Compass. I know Sonia's here on the call, and Connections for the Homeless in Evanston. We've also been working very closely with the Alliance to End Homelessness in Suburban Cook County, where I'm a board member. The amount of communication and support that these agencies have provided each other has been really inspiring. We appreciate all of it. Switching gears, I just want to speak briefly about how the grant is supporting our education efforts for clients. Our end goal is to get as many clients vaccinated as quickly as possible and improve their access to primary health care. So the Equity Lab that was recently sponsored by the grant helped us better understand the effects of race and culture on healthcare disparities and the desire of various people to receive the vaccine that's coming out. We took that information and we trained up our staff so that they're better engaged, they're better prepared to engage in a dialogue with clients about what they want. And being a part of this grant has helped prepare our staff to be better listeners and to provide access to the most accurate information possible for clients. We've also appreciated the opportunity to contribute to the ongoing peer-to-peer discussions alongside Cook County Department of Public Health personnel. The peer discussion we participated in was really impactful. It explored how to be more culturally sensitive to various populations of people, and it helped us contribute ideas about using harm reduction to engage clients who may be skeptical of the public health messages that are coming out. Currently, this grant is supporting one-on-one conversations with clients. It's helping us disseminate flyers and other types of things. And it's supporting our conversations about infection control and COVID vaccinations in a culturally sensitive manner. Although we are at the start of these efforts, and we know the rollout of the vaccines is just ramping up, we do very much appreciate being a part of this effort. Thanks.
Todd, thank you so much. We're glad to have you as a partner, and thank you for all your work. Next up, my friend, Sonia Ivanov, who I met during my first days in office when we were doing a point-in-time count. We've got Sonia here today from Northwest Compass. Thank you so much, Sonia. It's great to see you here today.
Thank you, Commissioner. Thank you very much for inviting us. It's like I'm excited to be part of the award, as our agency is very excited to be part of the award. We are very grateful for the partnership that we have with Commissioner Morrison and his staff. And it's like I'm lucky enough to be the third person to talk about it, because it's like most of my colleagues already shared the enormous impact of the grant in the community and the clients that we serve. Northwest Compass is in business for more than 35 years, and we serve everybody in the Northwest suburbs of Cook County. Anyone that is like facing some personal, economic, or housing instability or homelessness. The COVID pandemic impacted our community greatly, and even though we are in a most affluential part of the Cook County area, there were a lot of people that are struggling with food and housing insecurity, and definitely like a job loss, income loss, insecurity, mental health issues, and so forth. And having an ability and opportunity to expand our outreach and to educate more people and to spread accurate on-time information about COVID and protection and different type of services that we have in a community was extremely, extremely great, helpful for us in general. As Todd said, it's like all the conversation that we have with the Equity Lab, with the peer conversation, were very impactful and really, really restore our hope, like a hope in humanity that we are all in this together, and together we can beat the virus and rebuild our country and go forward. We never closed our doors since the beginning of the pandemic. We were open. Thankfully, we survived and we are safe. Only one of our clients got affected, but thankfully they recover. We continue providing all the services that we have, like stabilization, empowerment, housing. Our food pantry was open to anyone in a community that needed some kind of food, clothing vouchers, hygiene supplies, and so forth. We continue providing like any type of educational event. Housing is the biggest portion of everything that we do. We start delivering food and hygiene and cleaning supplies to 3 different local schools in the area, together with like our delivery of food and supplies to previously homeless veterans. We offer some professional cleaning to some of our housing program participants. And a main piloting program that we started is not just educating the community and providing personal protective equipment, masks and sanitizers and care packages to anyone that needed. We also deliver it to a different, like a subpopulation in the area. And something that it's like I want to mention, it's like I thought already talk about like a clients that they had, the journey had to place in a hotel to kind of provide safe and healthy environment. Unfortunately, because of capacity, they were not able to place everyone in a hotel that needed this type of assistance. And our agency started placing in a hotel, and we had 86 people placed in a hotel also, just because it's like that was the most safest way to keep them healthy. As a part of the grant, we are very excited about like a opportunity to work with more organizations, definitely opportunity to work with the commissioner in the Cook County and spread more information about the upcoming vaccine, the way that people can register and learn more about it. It's like a definitely testing sites, information about people that do not have insurance and are worried about like a payment for testing and so forth. We are just in a process to establish like a partnership with one of the federal health center in Wheeling. Definitely in our area, Arlington Park Race Course provide free testing, which we spread the word about. And thankfully, it's like we got a huge donations of different, and plus the amount of money that we got to the grant, we were able to purchase some hand sanitizers and masks, and it's like a cleaning supplies and so forth, which are extremely helpful to people in our community that are facing financial difficulty. I don't know how much time we have, and it's like I definitely would like to hear more about the Cook County and Dr. Joshi about like the new initiative and so forth. But I just want to say that it's like working together makes a huge difference, and definitely it's like I'm very positive and optimistic that it's like soon all the crisis will be behind our backs. Thank you for having me.
Thank you so much, Sonia. We're grateful to have you here today. And next up, without further ado, we've got Yin Keen from Thinking Beyond. Thank you so very much for being with us today.
Well, thank you very much, Commissioner and Dr. Joshi and everybody here. My name is Yin Keen. My organization, Thinking Beyond, the mission is supporting philanthropic and charitable projects with innovations. Much to learn from everyone because the organization is a baby organization. In fact, I'm very grateful for this award, as this is my first grant award for this newly formed organization. I myself is not a newcomer in the community and in the community service, formerly an advisory council for Mayor Daley and for Jesse White. And so my reach, being a Malaysian, was kind of like truly Asian. So has been working with a lot of community organizations stretching from Chinese, Korean, Indian, and the little ones like the Mongolian and Vietnamese, you know. So it's the entire stretch of Asian group. And given my background, my expertise is in healthcare and in the PhD program for public health informatics, and I work a lot with Medicare healthcare plan insurance. So my reach for senior community and healthcare focus is all there. So this grant is very timely and very appreciative of this grant that enables me to then start connecting to the organizations that are not part of this grant, kind of work on a B2B level to start with the outreach, right? That the masking flyers and all that. So some of the success that have been happening in the past month or so is talking to a number of organizations like the Korean Cultural Center, the South Asian group, folks that are connected to the mosque and all that. So we are putting flyers out in these organizations, and one reach is about 100 flyers, right? 200. So the one that is very that I could mention very, very successfully is really the Association of Retired Asian Americans. So because of the COVID, the lunchtime program was on a pause, and so they have the food delivered, to all the seniors. So through them, the reach is about 200. The educational piece of the flyers. So that's one idea for the month of December and January. And moving forward, I've already had sponsorship and acquired many, many testing kits. And so, and these testing kits work in a way where I can actually deliver to that, well, not me personally, but arrange to have delivery to that facility, have it tested, and then folks will pick it up and send it to the lab to get results within 24 and 48 hours. I believe a distributed testing and much needed testing is the way to go to get more effective process of testing. So if any of you is interested in such a testing approach, I'll be happy to share and see if we can improve the volume of testing. So that's what I'm doing. Still kind of learning my way through, and in working with UIC, I'm very honored because part of my hat is in academia and still teach adjunct for the University for Statistics. So these observation and these data in seeing what's happening is going to be very instrumental in packaging further information dissemination and feedback. How do we actually improve our public health? So thank you.
Yin, thank you so very much. We're grateful to have you here today, and thank you for all your work. And Without further ado, my friend, Dr. Kiran Joshi, who throughout this time I have called way too much over the past 9 months, but I thank him for all the work he's been doing to serve our residents during these unprecedented times. Dr. Joshi is the Senior Medical Officer and Cook County Department of Public Health co-lead. Thank you so much for being here today.
Thanks so much, Commissioner. I want to pause here and just thank and acknowledge the phenomenal work that my colleagues here on this panel are doing. They're on the front lines doing the work and really advancing the public health in suburban Cook County. So really, on behalf of our agency and from the bottom of my heart, thank you. We first started talking about our plans for this contact tracing initiative many, many months ago. So to now see all that work and planning come to fruition, it's just, I can't describe how wonderful it is. So we heard some phenomenal work being done. I wanted to just zoom out and provide a big picture overview of what's happening with what we're calling the Community Supports Program. And then I'll shift to talk about vaccine and our vaccination program going forward. I don't want to monopolize the time here this afternoon, so I will try to be brief with my comments. So just specifically with respect to the Community Supports Program, from the beginning, we were very clear that, given the substantial amount of grant funding we had been awarded from the state and the federal government, we wanted to make sure that a substantial proportion of that made its way directly into communities in suburban Cook County, and specifically to community-based organizations that provided that essential safety net for our most vulnerable populations. So when we awarded $5 million to community-based organizations throughout suburban Cook County, when we were making decisions about that, we were thinking really hard about how to ensure that that was done equitably. So again, it was $5 million total throughout suburban Cook County. The work began for most community-based organizations on December 1st. And, just given, what we heard just now, it's clear that CBOs and you all have really spun up incredibly quickly to respond to this urgent crisis. There were two options for organizations to participate. One was participating in what we were calling a Learning and Action Network. And another option was the Learning and Action Network, along with either participating in community education and outreach, expanded support of an existing program, or community-based testing, which I think was referenced by some of my colleagues earlier. We also had a separate program called our Worker Protection Program, through which we partnered with a coalition or a collaborative of worker centers, which was designed to promote and protect the health and safety of low-wage and temporary workers in suburban Cook County. And I think this is really crucial because we've seen over the course of this pandemic that many low-wage workers, vulnerable workers, immigrants have been adversely impacted in the manufacturing sector in particular. And so we wanted to have something targeted to specifically that group of people. So again, some amazing work there. We've seen some amazing work been highlighted, and I'm confident that there's much, much more to come. So I'm going to shift now to just talk about vaccines. So much has been covered in the media, so I'll try to keep my comments about the generalities high level. I think most folks know at this point that there are two vaccines available. They're mRNA vaccines. That technology is old, but the application to vaccines is new. And that novel application is what's allowed us to bring these vaccines to market so quickly. Both vaccines require 2 doses at different times, about 21 days apart for the Pfizer, 28 for the Moderna. And that just brings an additional layer of complexity here because now we've got millions of people who are going to require 2 doses of vaccine. So this is all going to have to be choreographed very carefully. Both vaccines have been shown to be safe and effective. I want to be very clear about that. They're safe, they're effective. The way the trials were done, that process followed the normal process that we always follow to study vaccines, starting with animal trials, then going to small-scale human trials, and then expanding to trials with tens of thousands of people over months of time. We continue to collect data, and data continues to come in. And if there are any new safety issues that we discover, we will make those very, very clear and available to the public. I think many people are curious about whether vaccines are effective against the new variants or new strains of COVID that we're seeing come out of various parts of the globe. We have no reason at this point to believe that they're not effective. And I, again, would just encourage everyone who's eligible to be vaccinated on that basis. I would also simultaneously caution everyone that while the vaccines prevent us from getting bad COVID, from getting COVID that causes us to become very, very sick, we're still not sure if this low-level transmission could persist. That is, you could be vaccinated and still contract and pass on the virus to others and not even know it. So it's really, really important that we all continue to follow the good public health guidance that we've been talking about for many, many months now, which is to, wear a mask, watch your distance, and of course, wash your hands. There's been much discussion about phases, and again, just very high level, the federal government has issued phases to help us prioritize who should get the vaccine and when. So that first phase is phase 1A, which is the phase that we're in right now. And that essentially is designed to prioritize healthcare workers and folks in long-term care facilities, because those are the groups that have been most affected. We do anticipate that we're going to be in phase 1A until at least mid to late February. The next phase after that is phase 1B. And phase 1B is what the federal government calls frontline essential workers and individuals that are 65 years and older. That's the next phase that's coming. You may have heard the Illinois Department of Public Health announce that that's coming as early as next week for the state. We do intend, though, to continue to prioritize healthcare workers over the next few weeks until we have essentially gotten through that group. And then we, as a suburban Cook County jurisdiction, would move into phase 1B. Phase 1C is the next phase, and that's essentially individuals who are 16 to 64 years old with high-risk conditions. It also includes any essential workers that weren't included in phase 1B. The next phase is phase 2. That's more or less everyone else. So what is our strategy to ultimately get shots into arms? Well, given that we have a jurisdiction of 2.5 million people, this is going to be a huge team effort because we need to get to at least 70% vaccine uptake to get to what we call herd immunity, the level of immunity that we need to stop the spread of COVID-19. So we see ourselves partnering across a number of different sectors and groups to get everyone in suburban Cook vaccinated. You may have heard of a federal pharmacy program that's a partnership with CVS and Walgreens through a federal contract. CVS and Walgreens teams are essentially making their way through all the nursing homes and assisted living facilities and other facilities in suburban Cook County to ensure that all those residents and staff are vaccinated. We are also partnering with a number of pharmacies in suburban Cook County, such as Jewel Osco, Sam's Club, and Walmart, and others, to vaccinate healthcare workers in suburban Cook County. Of course, we're also working with our very own Cook County Health. Cook County Health Clinics, I think notably in the northwest suburbs in Arlington Heights, have begun vaccinating healthcare workers from the community as of earlier this week. That's only going to expand. We're also working with other providers, including private clinics and federally qualified health centers. There's much, much more to come, including large community-based sites. All of that is being planned and is in development. For now, I would say if you are a healthcare worker or know a healthcare worker or an organization that employs healthcare workers, please go to our website at cookcountypublichealth.org and register yourself or your organization, the links should be front and center for you to do that. So I'm going to conclude my remarks there. I'm happy to take questions. And once again, thank you to Commissioner for convening this group. Thank you for all the panelists for the amazing work that you're doing. And thank you to all the viewers for tuning in. Appreciate it.
Thank you so much, Dr. Joshi, for joining us today and all of our incredible panelists. I just want to put a reminder for the folks who are joining us live right now. If you have any questions that you would like addressed as we're moving to the discussion portion, please put them in the live comment and we'll be happy to get to them. As well, if anyone watching the recording, if you have questions, send us your questions. We'll be happy to reach out to our panelists to get you some answers. Oh, and if we could put some, when you're not speaking, if you can mute, I think we're getting some background noise. Thank you so much. The first three questions that we got in from the public are all quite similar, so I'm going to kind of link them together. We've got one from Debbie, Claire, and Christy. They all concern the latest announcements concerning vaccine distribution to seniors and folks who are 65 plus. One was, when will seniors over 80 receive vaccines? And the next two were really quite similar. When does someone over 65 with pre-existing conditions apply to be able to receive the vaccine? Someone was told they can't receive their cancer treatment until they get the vaccine.
Yeah. I think both are tough situations. I would say that, again, we're in phase 1A right now. We're prioritizing healthcare workers. Just, in terms of numbers, we've got about 100,000 healthcare workers in suburban Cook County. As of now, about 62,000 have been vaccinated. So, you can do the math. We're vaccinating about, I'd say, 5,000 a week at this point. So I'm hopeful that we'll proceed expeditiously through that group, through that large group. And get to that next phase, which is going to be your 65 and up, as soon as 3 to 4 weeks, as late as end of Feb, right? And that all depends on vaccine availability and the number of folks that are out there vaccinating. And we're working on both fronts right now. I think that responds to the second question. I'm not sure. Did I respond to the first part of the question, Commissioner?
So it was. Do we have, I guess, a timeline of when we'll be moving in to vaccinations of folks who are 65 plus, and then we had someone who was told that they couldn't receive their cancer treatment until they received the vaccine?
I'd say, so phase 1B beginning mid to late Feb at the latest.
No, thank you. I greatly appreciate it. I can't count how many phone calls I've been on this past week. However, I tell everyone that if there's any goal for the first 100 days of the Biden administration that I really hope that he succeeds in, is that goal of 100 million vaccines in people's arms within the first 100 days. Because like many, I'm ready to get through this pandemic, as I'm sure many of the folks tuning in are. We did get another question. I believe I know the answer personally, but I'm going to let Dr. Joshi answer it too. How about caretakers that are family members to elderly? Can they be considered as essential? And I believe the answer is yes, but you're going to tell us.
Yeah. And so, we've had many inquiries about this, specifically for home health and then for family caregivers as well. And the logic here is that these are often low-wage workers that live in the community and then go to people's homes who are particularly vulnerable. And so it makes sense from both of those perspectives that we would prioritize them for vaccination and, yes, consider them as healthcare workers. So our position on this is that they do fall into phase 1A.
Amazing, amazing. And is there a process for folks in that situation to sign up to be able to get in line for the vaccine?
Yes. And so, again, I would refer those good folks to our website and have them sign up. Again, that's, I think someone dropped a link into the chat, but it's cookcountypublichealth.org. Thanks.
Fantastic. And I got to commend our Cook County Department of Public Health and the tech team for operating such a state-of-the-art and helpful website. I always have a tab open to it, and I'm checking it quite often.
Commissioner, if you don't mind.
Yes, of course.
I just want to commend Dr. Joshi and the Cook County Department of Public Health and HECTON I think that I really want to go back to the point that you hit on, reaching vulnerable communities. And I think all of us today at the panel really just do that. This opportunity that was provided to us to reach our respective community members with, the language, speaking the language, that trust that we already have with community members. People know us, they trust organizations in their communities. Accessibility. I mean, all those, that I truly, genuinely, and I know my organization genuinely, appreciate the intentionality and the strategic process that took place to really invest in community-based organizations to reach community members. Because one of the things I will tell you, 9 months ago when COVID came out, I will tell you, even though as an Arab American, and I will tell you, we have many doctors and we have many nurses, and it's one community that's populated with healthcare workers. It was extremely, extremely hard to find information on COVID in Arabic. It was extremely hard. And we struggled as an organization. How do we educate? How do we do outreach in our community when we didn't have, yes, we had an abundance of healthcare workers, but we didn't have language on that information to provide to the average person. And I think this is, after, of course, moving along now, but the fact that we can be in communities and educate, we're proud of, as an organization, actually tomorrow we will be celebrating, we're having a virtual graduation. I invite you all to join us. We have 47 Arab Americans, Arab community members who will become the first community health navigators on COVID, ambassadors in the community that will go out and educate and do outreach. And this was, again, a grant through the state, the Illinois Welcoming Center. And so with other partners, who we invested to really educate our community members and really empower them and educate them and, lessen the fear in communities. And that's what happened, and that's what our goal is to, lessen the fear, mitigate COVID, and what better way to do it than really provide education and knowledge in that respective language. So thank you again so much.
Thank you so much for sharing that, Narman. And, language access is critical, and it's something I've been advocating and shouting for very long. I grew up in a family that was first generation Italian. My grandparents spoke Italian. So I recognize how important language access is. And I'm glad that the county is taking strides to help and make sure that we're able to reach out to all of our diverse communities within the county. We did have a follow-up question from Julie Demos about caretaking. So Dr. Joshi, she is taking care of her ma who lives in Cook County, but is a resident of DuPage. Would the recommendation be to go to the DuPage Public Health Department's website?
So our position has been clear from the beginning that first and foremost, our overriding principle is that nobody should be turned away. So to that end, we are vaccinating anyone who lives or works in suburban Cook County. We've been clear with that with our partners. If somebody happens to live and work right on the DuPage County border and they come to a place in suburban Cook to get vaccinated, am I going to say no to them? No, I would not want that. So again, we don't want anyone to be turned away. If you want to register on our website, we welcome you to do so. Is it a bad idea to also register on the DuPage County website? Probably not. I think that's fine, but I wanted to be clear about our perspective as an agency.
Thank you so much. That's very helpful, Dr. Joshi. I really appreciate it. And just a reminder to folks tuning in live, if you have questions, please submit them. We'll be happy to get to them. The first question I have for folks today is, what challenges as a community-based organization have you faced to ensure that people you serve receive and follow current public health guidance? And I will start with Sonia. Muted. You're muted.
Yes, I figured it out that I'm muted. The biggest challenge actually for us was because we stay open and it's we never did virtual services except very few, we had to meet the public. And it's the main challenge was at the beginning, how we're going to restructure our office and make sure that everybody is safe and follow the recommendation of the CDC and procedure and so forth. That's why distribute, even before we even got the grant, we had to kind of focus on education, and we had posted flyers and information everywhere. It's like I mean, it's kind of some of the information, obviously it's like a common sense, wash your hands, and it's like keep distance, and if you're sick, don't come to the office, and all those things. But it's like we had to create our own flyers and small like informational posting everywhere in office for people just to be familiar with the procedure. We started distributing masks from the get-go. Thankfully, it's like we had a large volunteer group that was sewing masks in their houses and delivering it to us. That's why it's like we had a box of masks that we can distribute to clients right away. And then obviously it's like, because as you know, they were very difficult for people to find sanitizing products all over the stores, because everything was like a purchase in the first week. It's like we were fortunate enough to have some of those like small boxes of Lysol and different like I don't know, like alcohol wipes and everything else that we distribute. And that was like a very difficult part. On top of it, it's like we lost all of our volunteers because most of them were elderly, and it's like obviously they were not able to help us out. Staff had like enormous new level of task and work that they have to perform. And because we have our own housing programs, we have like more than 30 apartments across the northwest suburbs. It's like we make sure that provide enough education and information and make people aware. It's like what they have to do and how to keep well safe and so forth. I mean, basically, we had to start a lot more new initiatives without being health professionals. We had to become quite aware what to say, how to say it, and get like up-to-date information that we wanted to distribute to the community that we serve.
Fantastic. Thank you so much, Sonia. Thank you for sharing that. And next, I would like to go back to Todd Stahl. Just curious on, Journeys serves some of our most critical, unstably housed individuals here in the northwest suburbs and the north suburbs. How has it been? What challenges have you seen with your organization trying to share these critical health guidance information with your community?
I think trying to make the time to have the face-to-face conversations, even in this time of COVID, where you got to put a mask on, but to have the face-to-face conversations with clients, to listen to them and educate them and, discuss all the feelings that they're having, discuss the different information that they're being exposed to encourage them to rely on healthcare providers, legitimate information, and to really focus on that. But taking that time, I think, it's the biggest logistical challenge because we're a small agency, but it's been, in our experience, the most effective way to go about this. And if you can't get a face-to-face conversation, a lot of things won't necessarily work out. You can give people flyers, as many flyers as possible, but then there's always going to be questions, and you have to be able to have a relationship with somebody. Having that relationship, I think, is the most important part of our work, and it's the thing that I most value about being at Journeys. And so, but that's time consuming. So, and as we know, everybody's stretched thin, costs money, but it's so worth it.
Thank you so much. I really appreciate it. And I'm going to go next to Yin King, and I'm going to change up the question just a little bit. You could discuss challenges, but I'm curious in terms of how have you changed to have more effective communications with the groups that you serve, and in terms of making sure they have the proper guidance, but also you could link in contact tracing and how to get the proper information concerning that out to your communities. Oh, you're muted as well. Sorry. Let's see.
Okay, can you hear me now? Yes. So to begin with, I don't have existing staff. Okay, so my first challenge actually is to even bring on board a couple of people. I train them, write scripts and give them a whole purpose, okay, why you're doing that. So it was a challenge to find people, because people are not, in a way, they're like going to be like first responder, right, out there meeting people. And the second is to train them to be like me, right, and to be effective and say, so they went through the training, understanding the background, the purpose, why we're doing this. So on that front, so the effective communication is actually even train 2 or 3 people who are going to be out there talking to other people in the community. I started making a couple of calls, okay, but people are not picking up phones, people are not responding. And even when I reached out to, let's say, the Punjabi group, the temple, right, the mosque, the Chinese temple and all that, nobody's there worshiping, okay, because nobody is coming. But they do have, let's say, one day that's open, people walking at different pace in time. So like Todd says, when you don't really have a massive group, then you have to rely on that effectiveness in saying it's going to take pace. My concept of the flyer is really a relationship building, because I know in that 6-month span, more is to come. So my communication to these people is, this is going to be an evolving educational process, okay? The flyer to say to mask, to wash your hand, all this is just a relationship building, because coming more will be maybe like testing, coming more will be information about vaccine. So in that 6 months, you're going to be seeing me. So that's the communication I have, that it's not just a one-time thing, but it's a development process to get us through to, well, that end point. Hopefully it's the vaccine and we all live happily ever after, right? So that's the communication I have with folks.
Amazing. Thank you so much for sharing that. And last, for the same question, I am going to move over to Nariman Taha, and a reminder to unmute. How has it been, shifting your communications, trying to make sure that we're getting this critical information to the public?
Thank you, Commissioner. So we've done it in several ways. So initially, I mean, one of the challenges was the uncertainty of this virus. What is it? How long? And so just to step back a little bit. So we're in office on an annual basis. We serve about 15,000 families. That's about 51,000 individuals. So on a daily basis, our staff, I have about 35 to 40 staff. And so on a daily basis prior to COVID, we were seeing about 100 to 150 individuals a day. Now, come March 17, when that happened, we had to shut all doors like any other organization and shift to remote work. So we do have, and from that, there was a transition. And so we had to kind of navigate and strategize how to best serve our clients and community. So we went, our staff are working remotely, but we do have projects, as I mentioned earlier, that have to be provided. And our method was a drive-through, where with our senior program, 3 times a week, they come and pick up their food. When we have serving our families, general families, we had food boxes that they can come and also pick up drive-through once every 2 weeks. With telehealth, we used our Zoom and virtual and the phone. So we have been able to shift and really reach the community. We've done, just like this, Commissioner, we've done many, many virtual, Zoom has become our best tool. Facebook, we've been reaching the community members through social media, through listservs, emails. We also host many workshops for our community members, whether it's our clients of domestic violence, whether it's our seniors, which we have actually taught so many of our seniors how to become tech savvy, navigate, WhatsApp, how to navigate Zoom. So it actually, forced us to really go to the next level with our clients. But like many of our organizations, we had to really jump on and say, how do we best educate our community members? We use our food drives to really educate them on COVID. We put in information, we put in flyers. When our seniors pick up, our staff educate, also putting in the bag itself, there you'll see information. And again, we have brought on invited Arab American doctors to speak to the community in Arabic about COVID. That was back in April or May, I believe. But using these platforms to reach the masses has been our way of reaching community members. And for our clients specifically, our staff have been holding workshops, internal workshops, inviting 15, 20 people to educate them and inform them and really bring them the latest information on COVID. But in that process, we've also, one of the challenges we had to face is not only was COVID the concern of clients, but one of the things that was really frustrating and sad to see, mental health was on the rise, anxiety, isolation, people felt alone, people didn't know where to reach out to, who to talk to. And so not only were we dealing with COVID, but we were dealing with other elements of how do we help individuals feel that we're still here for you, we want to help you, we want to be your support. And so staff also had to take on that, on that and say, how do we reach our clients not only on COVID, but how do we alleviate that stress? Our victims of domestic violence, have to live with an abuser, and then you have this virus, again, forcing them to be in that situation. So there were so many elements coming at us as an organization, and we had to take it on and say, how do we extend ourselves above and beyond to make sure that our clients are safe and stable and healthy?
Wow. Thank you. Thank you. That was incredibly powerful and really puts into perspective a lot of the factors that we're dealing with today during this crisis. And as is evident, everyone on this line has a critical stake in helping us get through this moment. And I want to be respectful of all of your time. I know we're getting close to the hour, so I do want to go around the horn one more time with any last thoughts, recommendations, advice. But again, I want to thank all of you for taking time and being part of this panel today. Dr. Joshi, I'm going to start with you.
I want to just close by saying thanks to you, Commissioner, for bringing this group together. I want to thank the group, the panelists that are, again, just doing such phenomenal work. Thank you on behalf of our agency, and again, from the bottom of my heart.
Thank you so very much. And I'll move on to Yin Keen. Any final thoughts? And we'll have to have you unmute, unfortunately.
Yes, yeah. It's very inspiring to hear, everyone, what you're doing, much to learn about, what's going on out there. And thank you, Commissioner, for this opportunity to get together. And Dr. Joshi, your time to learn what's going on and the progress that's making and, your end of things. So thank you, everyone.
Thank you so much for being here. Sonia, any last thoughts you would like to share?
Thank you so much, Commissioner, for inviting us for these meetings. Thank you for the partnership. Great information. It's like we are stronger together, and definitely I'm positive and hopeful that even though we have to work so much more and in a different ways, it's like we'll overcome it and we'll be better.
Thank you so much. Todd, next up, any last words?
Yeah, just to echo, I have a huge amount of respect for everybody that's doing this work. Thank you all. And get vaccinated. If you're thinking about not getting vaccinated, talk to your healthcare provider. They've got some great information.
And Nariman, last but not least.
Thank you, Commissioner. Thank you, Doctor. And I think to those listening, and I just want to say that, reminding everyone, please remember to take COVID seriously. It does not discriminate. It's not about your race, your color, your faith, what community, what language. COVID does not know that. And I hope that listening in, people take it seriously. Mask on, distancing, and washing your hands, and vaccinate. And I think that's the best way to help yourself and protect yourself and your loved ones. Again, to my community members listening in, again, COVID does not know, does not make any difference, does not discriminate. And again, thank you again for this.
Of course. And thank you for all of your powerful messages during this conversation. I want to thank all these organizations and the Cook County Department of Public Health for their stalwart leadership throughout these unprecedented times. And that's true. This virus does not discriminate. Throughout this pandemic, I lost a friend who was 33. I lost a friend who was 36. And just last month, I lost a friend who was in their mid-40s, who had a 13 and a 9-year-old. And so this is a virus that we must take seriously. We are not through the end of it yet. There's light at the end of the tunnel. But if we do what is within our control, which is keeping ourselves healthy, wearing a mask, trying to limit the contacts that we have, we will get to that light at the end of the tunnel and be able to celebrate and be together in the years ahead. You know, I remember I just saw a video of a senior. I believe she was 88 or so in Louisiana when she got her shot. And she goes, I'm so grateful for this opportunity to be vaccinated. She goes, when I look at it, it's not only about me and the days that I may be able to celebrate moving forward, but it is the fact that if I get vaccinated, maybe it's lowering my chances of potentially getting sick and spreading it to others that I care about within my community. And that is how we have to think about it. We're all in this together, and we all have our own duties and ability to safeguard those around us. And so I tell you, when it's my spot in line to get vaccinated, I will be there. I will be live streaming it. And I can't wait for us all to get through this moment. And again, thank you all for supporting our communities throughout this unprecedented moment. If you guys want more information, follow these great organizations, sign up for my newsletter. I'm sending out information all the time about services, opportunities to support folk. We're trying to make sure all that information is getting out. So sign up for my newsletter, follow my Facebook, follow my Twitter. We want to make sure that you get all the services available to you and your family during this time. But again, thank you all, and thank you for your leadership. Keep safe, keep healthy, wear your mask, and let's get through this together.
Thank you, Commissioner. Thank you, everyone.
Thank you.